Hey guys, it's Fridays.
Hey. So today's is about a kid, my kid might need a needle, but I don't think he's going to be able to handle it. What do I do?
What do we do?
Yeah, so I think we were thinking about this, and I think the best place to start with this is just to go, hey, like why are we even doing this in the first place, right? Why are we even having this conversation? And I think it comes down to the fact that with the baby teeth, like they are important, they're as important as adult teeth for them to hold on to.
Yep.
You can look at our previous episodes to understand why. All our interactions with adults, but obviously with kids as well, comes down to basically fixing their teeth, catching up their mouth to where they need to be, but also making sure that we maintain a good positive relationship with them long term, because it's important to have a good relationship with your dentist or your doctor or your health practitioner. Because I think we've said it enough times that it really comes down to having that long-term maintenance and long-term good relationship with the dentist, and having a good long-term relationship with your personal oral hygiene to be able to actually prevent all the expensive, complicated, painful kind of dentistry, right?
Definitely. Yeah.
And the last thing, I guess, is that kids are very sensitive, right? So you don't have to do much to kind of imprint like an emotion on them, which will imprint into a good or a bad memory. And so like if your eye's not on the ball and you're not doing the right thing, or if there is something that you just cannot do for them without causing like a little bit of grief, that's going to be imprinted in them, and it's going to sit with them for like 30 years or 40 years.
Definitely.
Like we see all the time with our adult patients.
Yeah.
And we end up needing to like put them through a lot of dentistry. So that means like big dollars, and like it just compounds the problem. It just compounds the problem sometimes. And then they need to spend a lot of money on sedation and this and that. And we don't want to do any of that if we can help it. We can start right here. And that's kind of our job as parents, like we're parents, and as health practitioners. So if we look at all of this, these needles and these fillings and all that through that lens, let's talk about what options we have.
So yeah, I mean, we want to plant that seed early, and maintain a positive experience. But so put it like this, a kid walks in and we have a look in their mouth, and they might need a couple of fillings, may need a tooth out, something like that. And that's not too common, but it does happen, and it's something that we talk to the parent about with hygiene and maintaining things as well long term, because that's just as important as treating the issue as well. But we look at it and say, okay, maybe we can get away with this in the chair, because the child's been pretty good sitting in the chair, comfortable with us looking in their mouth. We do the air and the spray and all that, and we say, okay, they can probably handle the needle. Let's potentially give it a shot at that next visit. Or we gauge them and say, okay, they're a little bit apprehensive, there's a little bit of concern, that they may have not come in before, or that they've never experienced anything like a needle in their mouth before. And so we'll have the gas ready, to something like nitrous gas, something they use in labour for women. Works very well with kids. Pop it on over their nose, and usually kids are quite comforted with it. It works quite well with them. And really you gauge it by your kid and kind of see how they're going to go. But definitely you get those kids who, you pop a mirror in their mouth and they just won't let us have a look at their teeth.
That was me when I was a kid. I'm a very anxious little kid.
Yeah, and you do everything you can, and you talk to the parents, you kind of get a gauge that, look, this kid is probably going to be a little bit apprehensive of getting any treatment done. And that, makes us think, okay, maybe it might be a better option to look at a more comprehensive sedation option, which might be in the hospital, because the last thing you want is to create a traumatic experience for that child where you're forcing them to have the gas, you're forcing them to have that needle and the drilling and the extraction, and
it's triggering all these negative memories and imprinting of how they're going to perceive the dentist going forward.
Exactly. And often it can be, the treatment option, the only option might be to get them in the hospital and do it that way as well. And yes, it probably makes life a lot easier in the sense for a dentist to do it that way, but a lot less can go wrong when you do it in the hospital as well, particularly with the child who's so apprehensive about having the treatment done. But it's something that the dentist will talk to you about, that we'll talk to you about, and to the parents about, to try and make the best plan so that we can make sure we maintain those teeth for the long term.
To put it in perspective, I guess, we as parents, we probably wouldn't be pushing for anyone to be taking our kids into hospital to do like general anesthetic or anything. Definitely. Having said that, though, it's a great tool to have. My brother-in-law, his sons had some varying issues with holes in their teeth when they were 3 and 4 years old, and they went to a pediatric dentist at my suggestion, and they kind of checked in with us going, hey, they said, should we go to hospital? And I said, definitely you should go to the hospital, because looking at the number of holes they had and like kind of their level of anxiety and stuff, it just made more sense. And now they come and see me every 6 months for their checks, and they're like 14, 15-year-olds, you know, and they have no problems with the dentist. And in fact, we have a ball. Like, if you follow like my stories and stuff on Instagram, they love it, and so that was a great example of how this can work really well. So I guess, like, to summarize, I think we're doing this mainly to build good long-term relationships with our patients, to make sure that they have a good long-term relationship with their dentistry and their oral health, because that's going to save them money, time, anxiety in the future, pain, all that kind of stuff. And bring them into the dentist that you trust and get that checkup, have a look and see what needs to be done. Think of the dentist as another part of the family in terms of having those decisions and the conversations together. And, if the dentist thinks that it's possible, we're going to give it a go. We're going to definitely try and get him in the chair. If we have to use some laughing gas, we'll do that. We'll do what we can to try and get him over the line that way. But if we can't, we've
got options. That's what it is.
And remember, we're doing it like for you and for your child to kind of deliver the best possible outcome right now, but also going into the future, into adulthood. And so if we remember that, I think we can't really go wrong.
Yeah.
Would you agree with that?
I think that's it.
I think that's pretty good.
See you guys.
Bye.